Health Minister Ong Ye Kung says Singapore faces 3 uncertainties with COVID-19 cases set to hit 1,000 a day.
This is almost like a rite of passage before humans and the virus achieve a new equilibrium and things stabilizes.
With local infections rising fast, Prime Minister Lee Hsien Loong gets his vaccine booster jab. And new migrant worker dorms must be built with improved standards. You're watching The Big Story live in the Straits Times newsroom. I'm Olivia Koy. You can subscribe to the Straits Times channel so you never miss a single episode. Health Minister Ong Ye Kung has given an update on Singapore's COVID-19 situation, with cases continuing to increase exponentially, hitting close to 1,000 new infections every day. Speaking this afternoon, Mr. Ong said there are 3 big uncertainties right now.
How long more daily cases are going to rise exponentially before the trajectory bends and then eventually turns downwards, because no wave lasts forever. If it doubles for the 4th time, we will see 1,600 cases a day. If it doubles again for the 5th, it will be 3,200 cases a day. That's the first uncertainty. Second uncertainty is whether we will run out of ICU capacity. We are ready to increase capacity of ICU from around 100 now to 300 or close to 300 beds at short notice. It also depends on what percentage of infected cases need ICU. And based on the data that Kenneth presented just now, it is low, between 0.1 to 0.2% overall. And we hope it stays that way, and better still, can be lower over time. Third uncertainty is whether our hospitals as a whole will be overburdened, running out of even normal hospital beds, with nurses and doctors not able to cope with the increased workload.
So with daily cases fast approaching 1,000, it's the first time in this pandemic that the majority of new infections are from the community and not from the migrant worker dormitories. Well, let's take a look at this week alone. The Health Ministry reported 534 new cases in the community on Monday. The number jumped to 755 on Tuesday. It continued to edge up to 770 on Wednesday, and it hit 803 yesterday. Professor Dale Fisher is here to weigh in. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Prof. So, given the rising daily case numbers in the community, we're likely to hit 1,000 very soon. Did you anticipate that Singapore would reach this mark so quickly?
Hi, Olivia. We certainly knew the case numbers would go up. We've been warning this for a long time, asking the population to actually understand that this is part of the process that we need to go through. And with so many people vaccinated, the vast majority will not get severe disease. It is Delta, so we know it's twice as transmissible as things we were dealing with last year. But yeah, I must admit I was a bit surprised. We really didn't ease much, actually, went to see these types of numbers. We really only allowed dining in small numbers. So it's not like we all took off our masks and we had large gatherings. It was, but I guess in that respect, it also tells us that all the measures that we did have in place were actually required when we were trying to contain the virus. So that's, I guess, useful information.
Right. I guess on the numbers front, Singapore has been here before. We have surpassed that 1,000 mark before, but that was confined to the dorms. So what's the strategy now, Prof, given that community transmission is less contained, shall we say, and should that strategy change?
Well, the strategy's changed. We're not trying to, I think in your sentence you said containing the community transmission, and we're not trying to contain it anymore. We're trying to contain it to a certain degree. We want to slow it. We don't know I think the minister just went through the unknowns. We don't know how this is going to affect hospitals. We believe we have good insight from overseas experience and from modelling and from how it's been trending over the last couple of weeks. But we'd still like to go slowly while we learn exactly what that impact is. So last year and up until a month or 6 weeks ago, it was really about containment. Now we're in the transition phase to endemicity, which will be all about protecting the vulnerable, protecting those people in hospital and things like that.
Well, Prof, looking at the speed of infections, what are the numbers that we should keep an eye on before the wave peaks?
So there's no doubt, there's no dispute that it's a severe disease is what matters. Case numbers, we can expect those to go up. What we don't want to see go up is people in intensive care, people dying, obviously. And of course, this is going to be largely driven by the unvaccinated. We know our population's 5.7 million, so there's really 500,000 eligible people eligible for the vaccine that still haven't taken it, and if and when those people get COVID, which they will with these large numbers, thousands in the country every day, then how much of an impact will they have? We know they have probably a 9 or 10 times greater chance of getting severe disease. So we just need to see how these numbers are going to impact on hospitals. So that's the one to watch. And if I could just say, look, if you're not vaccinated, please, it's not too late. It's never too late. Go and get vaccinated. Now what we've been warning had to happen as we eased restrictions is happening. The case numbers are going up, and the only way, the best way to protect yourself is to get vaccinated.
Yep, of course. Well, you know, people, especially seniors, are being asked to reduce social activities for 2 weeks. Is restraint like this what it means to live with endemic COVID-19?
No, this is transition. I think we're transitioning to where we need to be with a more open economy. Humans are allowed to interact again. We need this. This is why we live. So no, I don't believe we're going to be asking seniors to lock themselves away forever. But while we're still learning, and particularly if you're going through a vaccine process, and which takes sort of the first dose 3 or 4 weeks, second dose then 2 weeks, if you're in that sort of phase, then yes, lock yourself away, avoid large crowds until you've completed your vaccination program. But for now, I think we're asking everyone actually to stop a lot of social interactions, just try and take the edge off this increasing transmission while we understand more about the 3 unknowns the Minister spoke about.
Professor, thank you so much for sharing your insights with us today. That was Professor Dale Fisher, a senior infectious diseases consultant at NUH. Starting tomorrow, more eligible COVID-19 patients can opt to recover at home with a home recovery scheme extended to those under 70 years old. Currently, the scheme is for eligible patients younger than 50. Well, to qualify, these patients must be fully vaccinated with no severe underlying illnesses. They must also be able to self-isolate in a room, preferably with an attached bathroom, and have no household members who are older than 80 or belong to a vulnerable group. People who test positive and meet the criteria can begin home recovery immediately without having to be conveyed to a hospital or community care facility. Well, also from tomorrow, you can get antigen rapid test kits from 100 vending machines across Singapore, which will be available for 24/7 access. If you test positive on an ART and are asymptomatic, you're encouraged to self-isolate for 72 hours.
What we want to do through this modified new regime of self-isolation is to give you the empowerment to be able to take charge of your health, and particularly if you're asymptomatic, to allow you to continue as much of your activities in the community as is safely possible without exposing other members in your household, your friends, your colleagues, and other members of the community to any risk of infection. What is important is that you must isolate yourself from others at this time. And this is the socially responsible thing to do in the event that you're really infected, to protect others from being infected themselves. There is no need to rush to an hospital emergency department to get yourself tested. And where there's any concerns, you may go to one of our SPH'S clinics where a GP is able to assess you further and decide on the necessity to perform a PCR diagnostic test for you. In fact, if you rush to the hospital A&E department, you may inadvertently expose yourself to more risk because there may be other infected people present in the hospital.
Separately, all newly built migrant worker dormitories will have improved living standards, with authorities completing a year-long review as well as a pilot scheme in semi-permanent quick-built dorms. Among other changes, the new standards will include a cap of 12 residents per room with a minimum 1 meter spacing between beds. There's no maximum occupancy in existing rooms nor requirement for spacing. The occupancy limit per floor remains at 240 residents, but new dorms must now be able to be divided into self-contained sections of 120 residents. Communal facilities like cooking, dining and laundry areas must also be designed for dedicated use by up to 120 residents per section. Toilets must be shared among 6 residents, down from 15 right now. And at least 1 exhaust fan has to be installed in each toilet, along with an adequate number of fans in rooms for sufficient ventilation. All new rooms must also have free Wi-Fi instead of only in common areas currently.
We have developed a set of improved standards for new dormitories. The standards aim to strengthen the resilience of dormitories against future pandemics, thereby safeguarding the migrant worker community's health and also improving their well-being, whilst enhancing livability for the residents. We are reviewing the improvements that can be made to existing dormitories whose leases are not yet expiring in the coming months, and we hope to share more when we are ready. Now, we recognize that these improved standards for new dormitories may result in higher costs, as future dormitories may be more expensive to build or operate. However, prevention is always better than cure, especially as we have seen the potentially grave implications of a disease outbreak on migrant workers, employers, and our Singapore's economy. So investing in these measures today would put us in a stronger state for tomorrow's pandemic and save us from spending more in the future to manage outbreaks. So, like what they always say, we never waste a crisis. We've learned, we move on, we strengthen, we fortify, and we build resilience.
All nursing homes should receive ART kits by next week, which will help with more frequent testing. This comes as clusters are emerging in more nursing homes. According to figures available this morning, the Orange Valley home at Simei had 14 cases, Rensi at Bukit Batok had 34, Jamia Nursing Home in West Coast with 13, and 12 at All Saints Home. Prime Minister Lee Hsien Loong, who's 69 years old, has received his COVID-19 booster jab as recommended by Singapore's Expert Committee on Vaccination. Well, nearly 8 months after completing his 2-dose vaccination regimen, PM Lee got his 3rd shot this morning at Singapore General Hospital. He later said on Facebook that with cases increasing rapidly, a booster jab will strengthen one's protection against the disease. Besides those 60 and older, the Expert Committee has recommended an additional shot for residents of aged care homes and immunocompromised individuals. Businesses will be getting the second rental support scheme payouts from next Wednesday, September 22nd, a month ahead of schedule. Over $200 million will be dispersed to almost 36,000 tenants and owner-occupiers of SMEs, as well as eligible non-profit organizations. Well, this second payout will be equivalent to half a month of rent for the period of July 22nd to August 18th during the second Phase 2 heightened alert period. On the non-COVID-19 front, Singapore wants to attract more high-growth technology firms to list their shares here. Trade and Industry Minister Gan Kim Yong announced a package of schemes to help local and regional companies grow and prepare them for an IPO. One initiative will see the government and Temasek Holdings co-investing in a $1.5 billion fund aimed at helping firms succeed from the founding stage to their eventual listing. Sustainability-themed tours, green options for events. These are some measures in Sentosa's sustainability roadmap, launched today with the aim of bringing down its carbon emissions by 2030. In December, the first of sustainability-themed tours to raise visitors' appreciation of nature and biodiversity on Sentosa will begin. And by next year, Sentosa businesses will also start offering green options for MICE events and wedding packages, like elimination of disposals and locally sourced food produce. But very soon, from next month, Sentosa will start electric bus trials, and all its on-island public transport is expected to be electrified by 2025. Overseas, 4 veteran politicians from Japan's ruling Liberal Democratic Party filed their candidacies today in the race to succeed Prime Minister Yoshihide Suga. Taro Kono, the Administrative Reform and Vaccination Minister, is the shoo-in if the public can get their say at the September 29th poll. He routinely tops media surveys of their choice for the Prime Minister. While the other 3 candidates are Fumio Kishida, former Foreign Minister, and 2 women, Sane Takaichi, former Internal Affairs and Communications Minister, and Seiko Noda, the party's Executive Acting Secretary General. Well, the stakes are high in this election to pick the party leader for the next 3 years, as a general election must be held by November. A week ago today, shareholders overwhelmingly voted in favour of Singapore Press Holdings transferring its media business, including the Straits Times, to a new company limited by guarantee, or CLG. So what comes next? Known as SPH Media Trust, the CLG is a not-for-profit entity which will have to survive on a combination of private and public funding as well as advertising. It will also have to confront challenges facing both its print and digital businesses. Well, here with me now is Patrick Daniel, returning to the media industry as interim CEO of SPH Media Trust. Welcome to The Big Story, Patrick. So let's first talk about the public's impression, which seems to be that, SPH Media Trust is free from its financial reins now that the SPH's media business is transferring to a not-for-profit company. But that's not the same as non-profit, right?
Yes, of course. It's quite different. Actually, the important thing is to understand the difference between a listed company and a company limited by guarantee. Then the non-profit follows from, not-for-profit follows from that. So let me explain that. A listed company has shareholders, and the shareholders expect dividends. Company has to be profit-driven so that it can make profits to distribute dividends to shareholders. Quite a simple formula. A company limited by guarantee does not have shareholders. What it has is members who share a common public purpose. Okay? And the company can operate commercially. The difference is the profits of that company do not go to the members because they're not shareholders. The profits must be reinvested in the company for that public purpose. So that's the important distinction. One has shareholders, one has members, one is profit-driven, the other is purpose-driven. So that's the main difference. Now, the CLG, it can be a non-profit, not-for-profit. It can be a non-profit if it wants to be a charity, but it's not necessarily the case. It can be a not-for-profit, but it runs commercially, doesn't go out to make profit their number one aim. Whatever surplus they make, whatever profits they make will have to be reinvested in the company. That's basically the difference. Now, you and I can have a common public purpose and we can form a CLG, right? We can operate as a company. Whatever profits we make cannot go into your pocket or my pocket. It must go back into the company. If you want to build a retirement, a nest egg, don't form a CLG. You have to form a proper company. But if you have a common purpose, public purpose, and you make profits, and you're prepared to reinvest the profits into that company to continue to aim to make that purpose, then the CLG is the way to go. So that's the difference.
On purpose, you know, to our family, our friends, the uncles or aunties at the coffee shop, what does it matter to them if the Straits Times or any SPH Media Trust's other publications are under a CLG or a listed company?
Let me explain that difference. Big difference, you know. And here's the thing. Firstly, you have to ask, what is the purpose, right? So the purpose that we have established for ourselves as a CLG is we want to put out trusted, accurate news and information, right? Now, in this day and age, it's not easy to find, you know, you get all kinds of stories, and you're never sure whether it's accurate, whether it's fake, whether it's a misinformation, whether it's propaganda. We want to say that whatever we publish, we've checked, and we want professionally done, you know, by journalists of integrity, and we want to be that beacon of trustworthy news. Now that's a public purpose. Now, to the man in the street, it does make a difference. If you read something in the Straits Times, you know that we have checked, and we're not spinning it in, you know, falsehoods at you. You get tons of news come to you from WhatsApp, from all your social media feeds. You never know. Is it accurate? Has it been checked? And people are happily, you know, sort of forwarding stories without even checking whether it's true. So what we are saying is that it does make a difference to the reader that when we publish stories, we have checked, and what we are producing is factual, accurate, trustworthy news. It does make a difference. Yeah.
Well, Patrick, as you know, we're airing this online, on Facebook, on YouTube. What can our viewers expect in the future for the digital platforms under SPH Media Trust?
What can we expect? Well, we want to improve all our products. First thing is that, you know, we think that we've, over the last few years when profits came down, we lost a lot of good people. We lost talent. We struggled to keep up with the market in terms of wages and salary. So we've lost people, and we've not been able to invest as much as we would have liked to. I'm talking about SPH, the listed companies. We hope to reverse that. So I'm confident that give us time, in short order, I'm not talking of years and years, the difference will show. You know, we want to bring back talent, and you'll get to read more quality content from good journalists, people that you are prepared to pay money for. So you mentioned there's a lot of free content out there. Sure. So we too must know that, listen, why should anybody pay for content? You know, if there's so much free content. So apart from it being accurate and trustworthy, it must also be good content that, you know, that people are prepared to pay for. So I would say the quality is one area that will change, you know, with better journalists. And, you know, the formula is really quite simple. You have good editors, good journalists, you have good products. The better the journalists, the better the editors, the better the products. So it must show in the end. So it will show in the end. I'm confident.
Fantastic. Well,
Yeah.
Patrick, thank you so much for
Thanks.
making time to be on the show today. I've been speaking with Patrick Daniel, Interim CEO of SPH Media Trust. Patrick, enjoy your weekend, and you too have a good weekend as well. I'm Olivia Quay. Thanks for watching The Big Story. See you next week.
Thank you.